Hello, Governor Mifflin, families, students, staff, and larger district community. Steve Gerhard, Superintendent of Schools for the Governor Mifflin School District, presenting to all of you the draft for the health and safety plan for the reopening of schools for the 2020-21 school year in the Governor Mifflin School District. Before I start, I want to frame the presentation and the conversations and the work that still remain before us. Last March, we know that Governor Wolf closed schools across the state of Pennsylvania, and those schools remained closed throughout the rest of the school year. As we look to the reopening, we know a lot more than we did back in March, than we did in April, May, and June, and continue to learn more every day. What our charge was as a local school district is to look at our local context and make the decision that we feel is best as a local community. Recently, Governor Wolf, in reiterating his position on whether or not he would intervene at a state level, says school openings are going to depend on the confidence that we all have in moving forward. And what I hope to portray today in the presentation of the plan is the ability to build that confidence in all of us in the plan and in the implementation of the plan so that our students and staff can come back safely and return to school on Monday, August 24th. But I also want to, before I move into the plan itself, I also want to reintroduce myself, if you will, and provide some context to the person that is presenting this plan and leading this school district. I'm a lifelong educator. I am not a health expert. And this decision does have a great deal of public health considerations in it, which is why we've had to use these many months to make sure that we were doing more consultation with our local and statewide public health officials than ever before. But I also come to you as a resident of the Governor Mifflin School District. A 1987 Governor Mifflin graduate, I care very deeply about this entire community, its success, and its safety. I also come to you as a husband of a teacher in the Governor Mifflin School District. I come to you as a father of a high school junior who's anxious and excited to get back to school on August 24th. I also come to you as an uncle who has a nephew and a niece. I come to you as a friend of many in this community who also have students that are in this school, and many friends who are also teachers in this school district as well as other school districts. And mostly now, as we move forward in this presentation, I come to you as a leader in the role of superintendent. And what I hope that I can most be to all of you is as helpful as I can in navigating these uncertain times as we move forward. My intent is in this presentation is to be helpful, to provide as much information as I can within the appropriate amount of time that we have. I also want to make sure that I'm doing my best to define the reality. I understand well that through these months and the crisis that we continue to find ourselves, there is still a great deal of fear and uncertainty and hopelessness. And with that, some feelings of that the world as we know it is coming to an end. But I'm also buoyed by the fact that we have been working hard to become stronger as a organization, stronger as a staff, and stronger as a community. And I am proud of the work that we have done over these years to strengthen our community network. And it is my greatest hope that we can use those bonds that we have created over these years to now bond together in this time to help one another, to come together, and to find the certain path to provide the best quality education for our students, keep them healthy, keep them safe, and keep our staff doing their best work every day in a healthy and safe learning environment. So in the end, it is my hope through the presentation not only of this plan, but on the many communications that will continue to come, and mostly through the actions that we take once school has started, to build the confidence in all of us to find this new path forward. Recently, I had the opportunity to learn of an important town hall that took place with some infectious disease specialists as well as national organizations throughout the country. And there were 10 takeaways that came out of that town hall. And the first two are ones that I also want to convey at the start of this presentation. One was a recognition that schools cannot open and should not open if the virus is not contained at the local level. We know that the virus still exists, but we are not at a place where we feel that the virus is at an uncontrolled, uncontained level. And because of that, the second takeaway that was given to us is that is why it has to be a local decision at the district level on whether or not schools should open. And we need to use the data at a local level to decide as such. With that said, I would like to now move into the plan and provide the overview to you that is going to be provided to our local school board on Monday, August 3rd for their approval. In summary, I want to be clear that anytime we are called upon to implement school safety strategies, we have to recognize that they are never designed to completely eliminate risk. There is risk in all we do, whether it's through school shootings or the playground equipment. We put safe practices in place to do the very best we can to mitigate and reduce the risk that exists. And that is what this plan's strategies are meant to do. This plan is calling for the full reopening of school, all 5 days for our students pre-K through grade 12, with the recognition that there are families and students that would like to have an online option, and we will provide that. And it'll certainly be a more enhanced, rigorous, and robust option than what we experienced in the spring. And lastly, that in this plan, we know and we have to constantly be guided by the fact that the guidance and what we know about this virus continues to change on a daily basis. And as such, the practices, the protocols, and this plan are under continual review. And as the guidelines change, so too do we need to make changes to the plan. As the conditions change, so too do we need to make changes to our plan and our approach. As we've spent these many months doing our planning for the reopening and responding to the calls to reopen, we've consulted many reports and research documents. The more important ones are noted on this screen. Certainly Centers for Disease Control, to our own Department of Health and Education, Children's Hospital of Philadelphia. I would like to also add an important document that's not in here is the report released by the American Academy of Pediatrics. And then also some additional reports that came from PDE as well as the Pennsylvania School Reopening Task Force, made up of stakeholders from multiple organizations throughout the state. In addition, we have recently assembled a group of representatives from different stakeholder groups to continue to provide advisement for us as we continue to move forward. You'll see noted in there a number of administrators, our school doctor and pediatrician from Tower Health, Dr. Shatter, our school nurse, school board representatives, labor representatives, and parent representatives from our 6 school buildings. You also may recall a number of weeks ago, we had reached out initially to ask our families for feedback on where they were at that time in regards to the questions that we had in consideration of reopening. I want to thank everyone for taking the time to participate. We had a very successful participation. As you can see from our families, that is a very significant participation rate that greatly informed our decisions. Our students weighed in significantly, and so did our staff. Some highlights from our families' feedback. You'll see that a significant portion of our families would like to return to full-time in-person instruction. Now, we understand that that does not come without comments around making sure that the schools are safe and protocols are being followed. We also gathered information about district transportation. That current number would represent approximately a reduction of 50% of what our normal ridership is, which then provides advantages for us relative to provide social distancing on our buses. While there's concern about being able to wear a face mask all day long, I was pleased with the fact that our families, 90%, have reported that they have their students already wearing a face mask on a regular basis, which sets us up for success for the need for all of us to have face masks on during the day. And then you can see listed below what the top 3 concerns are if we need to return to a full online learning, and certainly all 3 of those are around the educational program for our family students. Highlights from our staff feedback. A majority comfortable or very comfortable returning to school, again, with the idea that as long as it is safe and as long as we are following those protocols, namely wearing masks, social distancing, and proper hygiene. Down below, you'll see the concerns or the needs, if you will, that our staff are asking for preparation for their return. And much of that is framing our current preparations and the preparations that will continue through the month of August. And lastly, our students. Certainly the majority of them, they would like to return to a full-time in-person educational program. I am also pleased that while there's legitimate concerns about wearing a face mask all day long, I'm pleased with the fact that the vast, very large majority have access to a comfortable face mask and are prepared to wear as such. Their top 3 concerns you can see listed. Item number 2 is certainly an interesting item, concerns from our students to make sure that everybody is doing their part by wearing face masks. Even self-reporting their own concerns of their mental and emotional health. And then when we asked them what their top 3 concerns were, if we need to return to online learning, you'll see naturally their concerns about their own learning and concerns that they have about their own feelings of loneliness and social isolation. So with the guidance from the various documents that I shared earlier, the feedback from our 3 larger stakeholder groups, we then matched that up to the template given to us by the Pennsylvania Department of Education to start beginning our plan and work forward. Our plan is made up of 4 larger planning areas: social distancing, cleaning, monitoring health, and then how are we working to stay in touch with our community, our staff, and our students. We know that by taking on this extra endeavor that is necessary comes at a cost. And we are thankful that we have received some additional grant funding to support those efforts. 2 larger pots of funding to help us with these emergency expenses for a one-time expenditure for this year include hiring additional staff to be able to not only provide additional supports to our students, but also to be able to move in and out of classrooms as needed should there be a need for teachers or other staff at different time to be on quarantine or at home, so that we can do our best to provide continuity of classroom instruction. We know that additional technology repairs and devices will be needed during this time. We're also well informed of the trauma and the mental and emotional health needs of our students during this time, as well as the needs of our families, knowing that there's still a significant number of our families that are underemployed, unemployed, and as a result are under-resourced and experiencing significant family stress during this time. So we need to, as a school community, provide additional supports for those students and for their families. We know through our additional cleaning protocols that we'll need to do that we need to bring some additional custodial staffing, and so we're bringing in some additional temporary help to provide regular cleaning through the day at various high-touch areas. And lastly, this all comes with knowing that we're going to need significant pieces of equipment and supplies in order to put cleaning protocols in place. That includes everything from hand sanitizing, disinfectant, as well as plexiglass and masks and face shields to supply our students and staff. Starting first with social distancing and safety protocols, these are the larger areas in which we had to make plans so that we could work to mitigate the spread from person to person and what we had to consider. First and foremost, I think what was most important, and I know is on the minds of many, is regarding face masks. We absolutely will be requiring that all students and staff wear a face covering, whether that be a cloth mask or a face shield. And this needs to cover their mouth and nose inside the school and while outside if physical distancing is not feasible. This is an absolute. Students and staff will not be allowed in the building if they do not wear a face mask or face shield. We will have face masks and we will have face shields on hand for students should they need some. We do know that there is going to be a need throughout the day for students to take face covering breaks, if you will. And so below you'll see some of the conditions that would allow students and staff to remove their masks. One, certainly at lunch when they're eating or drinking in space at least 6 feet apart. We've also been given guidance by the Department of Health that if students or staff are in a stationary workspace and 6 feet or more apart, that they can remove their masks at that time as well. And also if they're engaged in any activity where they are socially distancing, but it's a physical activity such as recess or physical education, or in the case mentioned earlier, face covering breaks. What qualifies as a face covering? Anything that covers the nose and mouth, and those face coverings you can see below, and that also may include a plastic face shield. Other building procedures, we are asking for a 30-minute later start time in our elementary buildings, K through 6. What this allows us to do is provide that staggered arrival of our students. As I shared earlier, we are expecting ridership on buses to be down, which means there will be a lot more vehicle traffic coming onto our campus. We are also planning to use multiple entry points to our buildings, so the combination of buses, vehicle traffic, and using multiple entry points in the door, we would like to have that additional 30 minutes so that our students can arrive on a staggered schedule and proceed immediately into their classroom. The other thing that we're doing in our buildings are changing our schedules. We are doing a block schedule at our high school every day, which cuts in half the amount of time that our students are in the hallway. Our students pre-K through 8 will be in cohorts. They will stay in their room throughout the day, and teachers instead will, at a middle school level, will come into the classrooms, and at a pre-K through grade 6, the teachers will stay with their students in that room throughout the day. We will put in schedules and procedures that account for traffic flow, one-way stairwells, and that sort of thing, again, to reduce the amount of time students are interacting in those larger communal spaces. In our classrooms, our individual student, we've removed all of the furniture that are in our classrooms other than student desks, chairs, and any furniture necessary for our teachers. So through the removal of that furniture, we've then been able to spread out individual student desks, have them facing forward, This will allow, again, social distancing protocols in our classroom. We know that the challenge that we have is separated to the maximum extent possible. The guidance given to us from the American Academy of Pediatrics and others is anywhere from 3 to 6 feet. So while in some classrooms, based on a class size of around 25, we may not be able to get to the full 6 feet, we've definitely been able to do it within the 3 to 6 feet. And with the face mask, we'll have those precautionary steps in place. We also then have to monitor how many students are in the hallways at any one time leaving the classroom, and ensure that masks and shields are used throughout the day. Bus procedures, so we will be asking our drivers to wear masks at all times. Our students will need to wear masks when they're on the bus. We will have ventilation from outside windows open, and cleaning will occur in between every run and after the runs at the end of the day. We will also be putting students in assigned seats that will again allow us to maintain the best social distancing possible on our school buses in the morning and the afternoon. I would also like to remind us that we are currently under a green phase. There was a red, yellow, and green phase protocol that was developed by the state, and we currently still find ourselves within a green phase. So we have done some separation of some changes that would occur should we move to yellow. Essentially, that is around the sharing of equipment. So you'll see, specific to recess and physical education, that we are taking steps to make sure that we are limiting the amount of sharing that is occurring among students in a classroom and from classroom to classroom, as well as scheduling the use of playground equipment. Our physical education classes, when possible, will be held outside. There will not be any use of our locker rooms other than to perhaps use the restroom facilities. The classes will do activities that are non-contact, and we will work to improve the supply of items, which again works to minimize the need for sharing. Our specials will be delivered in the classroom versus the classroom visiting the other specials. This will allow the teachers to provide instruction in the regular classroom, and the special area teacher, for example, art in the elementary, will only work with those 5 or 6 classes each day for a 30-day period versus working with the entire school building throughout the week. There is also some consideration for how our library circulation will work. And lastly, we know a big part of school life and school culture are assemblies or other large group gatherings, and we will not conduct those during this plan. Meal service, while we are in the green, we will be using the cafeteria, but we will also know to accommodate social distancing, we need to use other areas in our building, other large group areas, whether that be the library, whether it be large group instruction, whether it be our gyms. And then we will work to provide various arrival and dismissal times to, again, limit exposure. Our food service program is working to make sure that the food items are grab and go, and that at our point of sale touchpads, it will be replaced with scanners so students do not have to interact with the touchpads. We also, we know among the 3 major protocols for keeping ourselves safe that we need to have regular hand washing and hand sanitizing routines and reminders throughout the day, and provide education to our students to continue to do that, and provide opportunities through the day for them to do that. As I mentioned earlier, there are various aspects of our school culture and school life that will look different, and this is one of them. I've been very proud of the work that we've done over these years to invite our community, to invite our parents into our school buildings. Unfortunately, during the length of this plan, we need to end that for now. And so the only personnel that will be allowed into our buildings will be our staff, and then naturally our students or any other essential staff that visit our school building for operational purposes. All parent meetings will be held virtually. And unfortunately, again, another big part of our community life is volunteers, and unfortunately during the duration of this plan we will not have volunteer visitors into our school buildings. We will work with our child care providers and our adjusted schedules, as well as any child care programs that are using our building's facilities. Moving into the category of cleaning and sanitizing and ventilation, these are the larger areas that we have planned for, and have also used the guidance coming from both OSHA and CDC in what our cleaning and sanitizing protocols need to be. When we look at our common areas throughout the building, we have secured over 500 hand sanitizer dispensers that will be installed throughout. Our water fountains will be turned off. We are asking students either bring their own water bottle or, where available, use the bottle filling stations, and those stations will be disinfected multiple times throughout the day. Our restrooms will be closed on a rotating schedule to allow for thorough cleaning throughout the day. We will need to clean those multiple times, and any of our district-owned transportation will experience that same cleaning before and after. Supplies, I mentioned earlier, steps that we are taking to minimize the sharing of supplies, but if there are supplies that need to be shared, such as swapping out technology, those will be disinfected prior to distribution. Our cafeteria, in addition to replacing keypads with scanners, we are also putting other things in our food service line like tray runners, sneeze guards, and so forth. And as mentioned earlier, the grab-and-go items will be placed on trays by our staff to avoid excessive touching and handling of items. Some of our enhanced cleaning practices, our products are hospital-grade disinfectant products. Our staff will regularly clean both the supplies for the classrooms as well as the common areas. As I mentioned earlier, we will be adding additional temporary staff to help with regular disinfecting of our high-touch areas, and we will be conducting daily inspections throughout the day to ensure our cleaning practices are being implemented. We know one important guidance piece is making sure there is outside air being circulated, and we have worked to make those adjustments to make sure that there's a significant increase in the amount of fresh air that is being circulated through our system. We also are encouraging the opening of windows when possible and appropriate, but we also have to be reminded that with that circulation of fresh outdoor air on both humid days as well as on colder days, it will affect the indoor environment, if you will. And so we will ask our students and staff to be prepared for that and dress accordingly. I mentioned earlier, our protocols in transportation will be very similar. Our drivers will be asked to wear masks. We will have windows open to maximize ventilation, and we will do cleanings throughout our high-touch areas throughout the runs. In the event that we have a student or a staff member identified as symptomatic or test positive for COVID-19, we will be implementing the following emergency cleaning pieces for the impacted building. We will certainly conduct our tracing to determine the classroom and the amount of impacted areas. We may need to temporarily close, and this will be done in guidance with our Department of Health. And then we will use the various protocols of our disinfectant sprayers, ventilation systems, and remove buses from circulation for 1 day up to 3 days if necessary. Moving to monitoring student and staff health, these are the larger categories that we have conducted planning for. First one is we are asking all of our staff, all of our students, and the parents and guardians of those students to conduct daily health screenings prior to the start of each school day. You'll take a moment to read through the 4 questions that we were asking everybody to be very aware of and to be consulting each and every day. If you answer no to all of those questions, you come to school. If you answer yes to all or any of those questions, you stay home, and we ask you then to start communication protocols with the district. In our school nurse and health program, we will not be conducting temperature screenings upon entrance of buildings. Granted, we will have the need to do selective temperature screenings should the need present itself, but we will not be conducting temperature screenings on all 4,000 students every day and even among our staff. Our nurse and school personnel will continue to use standard precautions when caring for sick students because we know there are still other viruses that are out there, influenza, the common cold, and so forth. So we will still be working to treat those in our school buildings. Anybody, and with that, we will be creating isolation areas for any student or staff member who presents symptoms of COVID-19, whether it's COVID-19 or influenza or food poisoning, whatever those symptoms may be. We know that we need to create an isolation area. Then certainly after that area is used, we will be sure to disinfect it prior to its next use. We will be asking our families to report any out-of-state travel or international travel. We do this many times through the educational trip forms that you complete, but even if it's weekend or holiday travel, we are still asking you to report that so that we can work with you on an individual basis and look at the Department of Health and the CDC guidelines to advise whether or not you need to self-quarantine based on the restrictions in place for Pennsylvania from that travel, from Pennsylvania for that traveled area. We also are asking our staff to report the same type of travel that we are asking of our students and families. How are we responding should we have a suspected or confirmed case of COVID-19? You'll see on both sides, if a staff member or student is symptomatic and has been confirmed or is confirmed. We have several GM staff members that have completed contact tracing training. So internally, as well as in consultation with Department of Health, we can begin our contact tracing and our communication and a number of other protocols. It also allows us to keep a central list of students and staff so that we can work specifically in consultation with them and the larger building and community. In monitoring illness and the need to stay home, if a student or staff member tests positive for COVID-19, you'll see to the right the guidance that we are asking that student and staff member to follow, which is not to return to school for 10 days and at least 24 hours after fever resolution. Next piece, if a student is symptomatic but is not tested for COVID-19, protocol to the right is what will be followed. To the left, this is if a student has symptoms that their primary doctor determines that are not caused by COVID-19. As we've always done, we've asked that student or staff member to not return to school until symptoms are resolved. If a student or staff member is symptomatic but tests negative, similar, we're asking for that student or staff member to stay home until 24 hours after the fever resolution and improved symptoms. If a student or staff member is exposed and is asymptomatic, we're asking for that person to not return to school for 14 days from the last known exposure, if asymptomatic. The new guidance, as you can see, if they become symptomatic, what the guidance is relative to 10 days from symptom onset and at least 24 hours after fever resolution. In monitoring illness, if any of the aforementioned, we are asking our families to ensure that they are commuting with their building principal and school nurse if they are in quarantine, so that we can work with you to agree upon the date for return to school. We are also asking anybody who's in the same classroom, if they come into close contact with symptomatic individual, that they need to quarantine at home for 14 days. Contact their healthcare provider. We are defining close contact as having greater than 10 minutes of sustained interaction where you are less than 6 feet apart. We are not asking for a doctor's note, as we know that that may not always be possible for you to achieve that, but we are saying that you must follow the guidance that we have provided for monitoring illness and staying home. I also ask families in review of this plan to please be sure to go into Skyward and make sure that your information is up to date, as we will continue to use Skyward as our primary means of communicating with families. We know in this time it will be even more important to over-communicate with you on these matters, and we will plan to do as such. So please make sure your contact information is up to date. We will provide some additional information. We are working to improve our current district website with COVID-19 resources and information. That will also include this health and safety plan once approved by the school board. And lastly, what will our communication look like should we have a confirmed or suspected case? A communication will occur if a student or staff member is symptomatic and has been confirmed to have been in contact with someone who tested positive for COVID-19, or we will be in contact if a student or staff member tests positive for COVID-19. An important piece is if a student or staff member is symptomatic with no prior exposure and has not received a positive test, we will not be sending a formal communication. But we will be working with our custodial crew to provide enhanced cleaning protocols. Additionally, communication will occur if a classroom of students is in possible exposure with a confirmed or thought based on the conditions before. We will first send a message directly to the families and staff that were directly exposed to that student or staff member, and that message will be followed up with recommendations regarding testing or quarantine from the Department of Health. We will also then from there provide a second message that will be sent to all families, advising them of the situation and any subsequent action. We will not be releasing individual student or staff personal information. We will only be providing general communication to the situation that exists in that school building or in our district. In conclusion, through the presentation of this plan will now go in front of our school board for Monday evening, August 3rd, for their formal approval. This plan will then be submitted to PDE. And we know then, as communicated before, that with the approval of this plan, I will then be reaching out to all of you to communicate not only the in-person instruction, but also explaining the online option, knowing that there are families that would like to consider that option. And we will provide information to you at that time for how to register. We will also continue moving forward with our back-to-school reopening processes. I want to thank all of you for your review of this plan and support and patience as we've worked over these months to create this plan and use the regular guidance throughout these months to inform this plan. As I mentioned earlier, this plan is a fluid, dynamic one. We are consulting guidance every day, and we need to also be consulting the conditions on a local level every day and be guided by those conditions and by the guidance from our local and state health officials to move accordingly. So the plan that's being presented on August 3rd is where we are today. And we know, as I've mentioned earlier, we are going to have to learn to pivot as we move through this school year in implementing this plan and recognizing that there may or will be times when we may have to intermittently close due to various situations or conditions that arise. We know this will create great stress for our families, and it's great stress on all of us as well. And we will continue to do our best to communicate as early as possible so that our families can do the pivot that they need to on their end should conditions or circumstances change where we would need to move to a full online or move to an intermittent online option. So again, I thank you for your time. I thank you for your read and listen of this presentation. And I look forward to working with this entire community as we bond together to navigate what is certainly a very difficult time, but I'm strengthened by the bonds that we've created and believe that we can get through this as a local community and come through on the other end stronger as a result. Be well, stay safe, see you soon.